Hello, everyone. My name is Dr. Caroline Tatua. I'm a medical doctor, a public health professional, and a humanitarian worker. I serve as a technical advisor for health and sexual reproductive health with the International Rescue Committee, covering East Africa and Horn of Africa region. I have spent the last 18 years designing, fundraising, and supporting implementation of maternal and child health programs, both in development and humanitarian setting in sub-Saharan Africa. I am here to tell you about my project that centers on women and girls' health, entitled Integrating Gender, Equality, Diversity, and Inclusion, or JEDI in short, into maternal programs in humanitarian setting. So we know that women and girls, especially in humanitarian setting, continue to face significant barriers to making decisions and accessing healthcare services, despite many years and billions of dollars in health program investment. More uniquely, cultural barriers, gender inequality, economic disempowerment within patriarchal community systems, lack of inclusion of women and girls, and very limited engagement of men and communities, overall impacts on women and girls' decision-making and access to the much-needed essential care that they need. Furthermore, groups such as women living with disability and youth are consistently excluded in healthcare planning and delivery. When maternal health programs are blind on gender issues, they further propagate the injustices through delivering biased programs, allocating inadequate resources, enhancing already existing stigma, while ignoring the importance of engaging the communities. We cannot truly achieve significant and sustainable programming unless we have a JEDI lens. So I want to talk about this photo in front of you. This is a photo of the Great Pyramid of Giza in Egypt. It was built to endure an eternity and has done just that. There are many stories, perspectives, and adventures associated with this ancient relic. What fascinates me the most about this relic is that it's been in existence for more than 4,500 years and has assumed various identities in various eras and has definitely outlived those who built it. To me, it is the ultimate symbol of resilience, adaptation, sustainability, and transformation. The very qualities I envision about maternal health programs that have an impact and whose benefits continue way after the projects and programs are long packed and gone. So this is where I will tell you about my project. So my project, which is integrating JEDI into maternal and child health programs, seeks to be a foundation upon which maternal health programs can be more JEDI focused and achieve sustainable change. I am implementing this project within my organization with support from various instrumental colleagues and our organizational leadership. My immediate outcome is developing recommendations on JEDI integration into maternal health programs at the International Rescue Committee and translating this into practical guidance and policy for program managers and implementers in improving our maternal health programs. My secondary outcome is to replicate learnings and results from this to other sector organizations other sector programs within the IRC, as well as to other organizations working in humanitarian health. In the initial phase, I seek to understand to what extent maternal child health programs in our organization are integrating JEDI. I will collect specific information on key maternal health projects to understand the critical aspects of JEDI integration in these projects, including project staffing, project budget and resourcing, JEDI activity planning and execution, and existence and use of monitoring data and indicators specific to JEDI integration. I hope to analyze and submit key recommendations to my organization on how to enhance deliberate and purposed integration of JEDI into our maternal health programs. I am currently in the formative stages of my project, having gathered support from senior leadership and regional colleagues, and I am currently conducting analysis on existing policy and guidance this far. Over the coming weeks, I will continue to work with various colleagues and select country programs to follow through on my project steps. So ultimately, I see this project as a foundation for positive and sustainable change for gender-aligned programs that empower and engage women, girls, and the communities for improved health outcomes. I want to see maternal programs and contribute to maternal programs that ultimately result in women having self-efficacy, being empowered, having autonomy, and having all the support they need from their social ecological system to achieve their ultimate health goals. Now, reflecting on my leadership journey over the last 1 year, it has been an eye-opener for me. Through the years, I have had many points of learning and self-reflection about what leadership really is, discovering myself, my strengths, my weaknesses, and reflecting on how I can be a better, authentic, and resilient leader who can work with others in achieving great results. I have begun applying many of the learnings from this program in my day-to-day interactions and will continue to do so as I implement my leadership project. So what will it take for us to achieve this change? You may be asking. My closing thought and ask is that if we are to achieve sustainable and impactful maternal health, we will need to be more deliberate in shifting our mindset towards gender in health programs. Specifically, to my organizations and other maternal health organizations, we must be deliberate on designing, integrating, and actualizing gender in our health programs, designing, monitoring, and evaluation of the same. For donors, it is critical that you consider funding JEDI as a key component of maternal health programs to truly achieve value for money, cost efficiency, cost effectiveness, and lasting impact of the programs that we fund. Lastly, at all levels, we need to put in place accountability mechanisms and structures to ensure that we address JEDI commitments and changes to change the current narrative. Thank you very much for your attention.